So, what is Nystatin and how is it used? Nystatin is a medication that is used to treat fungal infections in the stomach or intestines. It works by stopping the growth of fungus. It's important to note that Nystatin tablets should not be used to treat fungal infections of the blood. When taking this medication, it's important to follow the dosage instructions provided by your doctor. Typically, Nystatin is taken multiple times a day, and it's best to take it at the same times each day. Be sure to finish the full course of treatment, even if you start to feel better. If you have any questions about the use of Nystatin, be sure to consult your doctor for guidance. You should take Nystatin by mouth, with or without food, as instructed by your doctor, usually 3 times a day. It may take several days to several months to complete the treatment, so be sure to use this medication regularly to get the most benefit from it. Take it at the same times each day. The dosage will depend on your medical condition and how you respond to the treatment. It's important to continue taking Nystatin until the full prescribed amount is finished, even if your symptoms improve after a few days. Stopping the medication too early could allow the infection to continue and result in a return of the infection. If your condition persists after several days of treatment or gets worse at any time, be sure to inform your doctor. Side effects of Nystatin may include diarrhea, nausea, vomiting, or stomach upset. If any of these effects persist or worsen, notify your doctor or pharmacist promptly. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the risks of side effects. Many people using this medication do not experience serious side effects. However, it's crucial to inform your doctor right away if you experience any serious side effects, such as fast heartbeat, shortness of breath, or muscle pain. While it's rare, a very serious allergic reaction to Nystatin can occur. Seek immediate medical help if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. Remember, in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking Nystatin, make sure to let your doctor or pharmacist know if you have any allergies. This medication may contain inactive ingredients that could cause allergic reactions or other issues. It's important to talk to your pharmacist for more details. Also, be sure to inform your doctor or pharmacist about your medical history, especially if you have HIV disease, diabetes, or kidney disease before using this medication. If you are planning to have surgery, it's essential to let your doctor or dentist know about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, Nystatin should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor. Additionally, it's unknown if this drug passes into breast milk, so consult your doctor before breastfeeding. The usual dose of Nystatin is usually 4 times a day after meals and at bedtime or as directed by your doctor. Be sure to use this medication regularly in order to get the most benefit from it. It's recommended to take Nystatin at the same times each day to help you remember. When taking Nystatin, it is important to be aware of potential drug interactions that may affect how the medication works or increase the risk of serious side effects. It is important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. It is essential to follow your doctor's recommendations and not start, stop, or change the dosage of any medicines without their approval. If someone has taken too much Nystatin and experiences severe symptoms like fainting or difficulty breathing, it's important to call for emergency help immediately. In the US, you can contact your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center for assistance. This medication is for use on the skin, or in the vagina or mouth. It is used to treat skin infections such as yeast infections, as well as oral thrush and vaginal yeast infections. The dosage and length of treatment will depend on the specific condition being treated. It is important to follow the instructions provided by your doctor or pharmacist. Nystatin is typically used several times a day, and it is best to use it at evenly spaced intervals. Make sure to continue using this medication for the full prescribed length of time, even if the symptoms improve before then. If you forget to take a dose of Nystatin, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one. Take your next dose at the regular time. Don't take extra to make up for the missed dose. When it comes to storing Nystatin, make sure to keep it at room temperature, away from heat and moisture. It's important to avoid storing it in the bathroom and to keep it out of reach of children and pets. And when it comes to disposing of Nystatin, don't flush it down the toilet or pour it into a drain unless instructed to do so. Instead, make sure to properly discard the product and it is expired or no longer needed. If you're unsure about the proper way to dispose of Nystatin, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.